My name is Marlow Ball, and I am a veterinarian here in Little Rock, Arkansas. I'm from Little Rock originally and graduated from Louisiana, and I've been practicing in Arkansas for about 9 years. So I am really working hard to try to keep up with all the new things that we're learning every day about Corona. Coronavirus, the novel coronavirus, COVID-19, is of course a very different kind of coronavirus than what we've previously seen in dogs and cats. Historically, coronavirus affects cats and dogs. There's very separate viruses that are in no way connected to the COVID-19 that we're seeing right now. So I've seen a lot of people ask about vaccines for coronavirus. These are vaccines that in no way cross-react or cross-protect against the coronavirus that we're seeing now. In cats, coronavirus causes a condition called FIP, which is a mutation of the coronavirus that leads to disease inside of the cat's abdominal cavity or chest cavity. In dogs, coronavirus, it's an enteric coronavirus, so it causes intestinal disease similar to parvovirus, but much more mild. So historically, we have vaccinated puppies for coronavirus for years. Unfortunately, it is in no way connected or related to COVID-19, which is a very different kind of coronavirus.
That's one of the frequently asked questions that we get is that covered? So you were saying it is not, and
Correct.
And it's gosh, okay. So in your expertise, what are some things that we can do to protect our pets from this?
Well, I'm sure everyone has followed the news as it's changed 20 times just in the last week. So originally it did not happen in pets. Now we know that to some degree it can happen in pets. However, there's no proof or knowledge that cats or dogs can get COVID and spread it to a human. We believe that dogs and cats are a dead-end host, so it may cause signs of illness even in our dogs and cats, but they cannot spread it to us. Knowing that now, I think it's important that we keep some distance from our pets if we are sick. And especially things like sharing food or letting them lick from your hand, things where there's real close contact between us and pets, we need to be really careful about that, because we know that some people can spread coronavirus without having symptoms. So this is not a great time to share your plate with your dog, and just be sure to wash your hands. In the event that you're sick, I would try to have some space while you are sick until you're better. Don't have close contact while you are sick.
For dogs with they're social beings too, and they want to get out and play with their buddies. What are best practices, suggestions right now for play? And again, like you said, timelines are constantly changing, and but with us also, thinking of opening Bark Bar and wanting to just be very, very cautious about that and interactions. And also, dogs are kind of like kids, they want to run around and touch everything.
So I think that it's a really good idea, of course, to make sure that people are washing their hands when they have contact with other people's pets. We can't stop them from putting butts in noses, and I don't have a trick around that because like you said, dogs are like kids, and they are going to go straight to the neighbor's butt, and there's no trick around that.
Right.
So as far as best practices, I think that screening people who are coming in to make sure that no one is actively sick is going to help reduce the amount of viral spreading that's happening. I think that making sure that there's lots of access to hand washing stations or disinfectant, hand sanitizer, are going to be, the main things that we can do.
Right. Okay.
The main things.
All right. Does anybody have any questions? I mean, has anybody, come across, anybody think of anything that you'd like to ask Dr. Ball?
Should we keep our dogs from like sniffing pee right now? Like, should we take them to a dog park?
Right
Right now.
Right now, there's no research to show that a dog can spread to another dog. However, our pets can act as a fomite. So if germs land on our dogs, they can travel, they germs spread around. I know, for example, dogs are not allowed in hospitals for therapy right now because we don't want our dogs to act as a fomite. We don't want our dogs to spread something around.
That makes sense.
So are you finding that this COVID-19 is as serious in animals as it is in people?
From what I'm seeing, we are seeing very mild symptoms. Similar in cats, I know that the 2 cats that tested positive had very mild upper respiratory symptoms. They were not febrile. They were not showing signs of severe illness. And I know that we had a pug this week who was the first dog in the United States to test positive. And this dog also had very
I'm sorry, you cut out at the very end. What did you say about the dog?
very mild symptoms.
What did you say about the dog?
Right. So, anybody else?
I have like 1,000 questions, of course. Hi.
Hey.
Yeah, ask away.
Yeah. Who would have guessed? So I'm not going to disclose how many animals that I do have, but a little bit of background about where my questions are coming from is I have an older service dog. He's still 11 years young. And I haven't been taking him to places. I haven't been taking him to doctor's offices, the store, pharmacy, nowhere. I've been taking him to the dog park only whenever he's like the only one there. And I also work with dogs. And with working with dogs, and bringing him with me to work, that's just terrifying to me right now. I also have cats and a ferret. So if I have multiple cats and all this is going on, like what precautions do you think that I could use? And also what symptoms are dogs showing?
So most people who are still going to work right now, for example, doctors, nurses, most people have a change from your clothes when you get to the home. So have shoes that you wear when you leave the house, and as soon as you get to your home, change shoes and put them in a plastic bag and put them away so that your pets don't have access to them. Kind of same idea if we're leaving the house and possibly coming into contamination, coming into exposure with germs. It's never a bad idea to leave a robe or something by the door, and as soon as you get home, just change to clothes that you wear at home, change out of your work clothes, so that when our cat jumps on our lap after a long day, we're not worrying about them having exposure. As far as, I think that the less contact that our pets have with people that we don't know, the better, as far as taking your pets to work. Just if people are washing their hands and we're just really who our dogs are around when they're not at home, I think that's going to be best practices right now.
Those are really good answers. I really appreciate those. What are the symptoms that dogs are showing?
I only know of the pug in North Carolina. They said the pug in North Carolina had symptoms of upper respiratory, so sneezing, coughing, nasal discharge, and the symptoms were very mild. It's interesting to me because a veterinary laboratory named IDEXX did thousands of tests in Korea when this all started about 2 months ago, and none of the dogs tested positive in the screening that they did, and they were testing pets from a positive COVID household. So when a human tested positive for COVID, this veterinary lab would come in and test thousands of dogs and cats, and none of them tested positive. So it makes me wonder if there's been a mutation. Something's changed from the virus that we were looking at there. It makes you wonder if has it mutated, and that's going to make things more complicated going forward because it's already breaking its own rules by changing.
Yep. Yeah, I do have another question, and I know all of us are thinking it, and all of us are needing it. I understand that, you're not a lawmaker or anything, but in your opinion, when do you think we could go back to Bark Bar, and what do you think the criteria is going to look like?
Well, I think that making sure that staff are checking temperatures. I think it's very fair to ask that anyone going into a setting like that has a way to test that they don't have a fever. I think that would be a good place to start. I think the tricky thing about this virus is that not everyone has symptoms or is sick when they contract it. I was doing some studying about the SARS virus, which is a similar virus that was much easier to contain because you couldn't spread it without visible symptoms. So it was easier to detect if somebody was sneezing and coughing and had a fever, you could isolate them. That's
Right.
what is so much trickier about this, is that people are carriers and spreading it without even knowing that they're sick. And there's a window of time where we can spread it before we know we're sick, if we even do get sick at all. So I don't know the answer to that. I think that social distancing, having protocols in place to encourage hand washing, to make sure that we're screening staff and screening people that come in, and trying to respect social distancing. And that's really hard with pets because they just want to sniff butts, and that
just want to sniff butts.
They just want to sniff butts. So that makes it hard because they can act as fomites. So if someone sneezes on a dog and then it runs to another person, and then that person touches where the sneeze landed on the dog, they can be a source of transmission, a source of spread, even though we don't think that they're going to get it and spread it to us.
Working with animals and just being close to so many animals, and then having so many at home, and that's related to my career. Like I'm training my cat, I'm training my ferret. Just being in a situation where I work so closely with animals, whenever they start opening up everything, would you recommend somebody in my position that doesn't really have the best immune system, but I do work really close with people and with their animals? and their animals run up to me. I'm the treat lady, and then I work with them, work with the people. Like, what is a good little safety balance, I guess? Would it be beneficial to put up barriers and just like torture the dogs and, get them used to not petting people? I'm like kind of getting psychological a little bit with this, like what do you think the future of kind of like doggy daycare or bark bar, dog interactions, dog parks, bark bar, everything. What do you think like interactions like that is going to be for like the next year?
I think that's a really hard question to answer. I also have concerns. We're doing curbside, so we're still open. We run out to the car, bring people's pets into the clinic, and then perform whatever services they need. And we are trying to troubleshoot how do we protect ourselves. What if the client is sick and sneezes on their dog, and then we brought them into the clinic?
Yes.
I'm not concerned about the dog giving it to me directly. I'm more concerned about the dog acting as a fomite.
Yes.
So the dog is spreading something.
100%.
I don't have the answers. I also am trying to navigate how to, do all of this safely. We are trying to make sure that everyone at work is checking their temperature, because if somebody has a fever, we don't need to be at work.
Yeah.
So we're doing that. We are washing our hands a lot. I try to use a designated towel that I'm going to use for that pet. And so we are, placing the towel on the floor during the exam or on the table, and then switching towels between each pet that we're examining. And then, of course, washing our hands frequently and disinfecting between patients. But I don't know the answer. I think that we have to be really careful about who is having contact with our pet, and are they washing their hands? Are they having good hygiene standards? And that's very hard to teach a dog.
Oh my God, yes. Yeah.
We have a couple of questions too.
Sure.
Ask away, Jessica Marcos.
Hi. You talked about mutation, and it kind of sparked a question in my kind of conspiracy theory we're going with. But I heard about the wet market in China with the virus kind of crossing between animals, and one idea is that's how it came about. Somebody ate a bat went through a pangoling on whatever. Is there any concern in your head about the virus mutating and infecting any of the animals that we eat, pigs and chickens and turkeys and stuff?
I think that's a really good question, and especially as we are looking at the markets and the close proximity that we have right now of sick people in contact with meat production. I think that a lot of things kind of work in our favors. I think that the reason that these wet markets are such a source of disease spread is because they have live animal and dead animal and multiple species of all kinds all in one place. So it's very easy for a live, most of the time viruses do not last very long. So if you have live animals and dead animals in the same place, it's really a high risk disease spread. So I do think that there's a lot of things working in our favor in the United States because of the way that the meat production is set up. But it does concern me that it's spreading through these meat industries the way it is because of close contact from person to person. but I think the chances of it mutating are much smaller in the United States because of the fact that there's separation of live animal and processed animals. And also there is a lot of, safety protocols, disinfection protocols that I think will protect us. But that's a really good question, and we don't know the answer.
When it comes to mutation, because that's honestly, mutation is something I hadn't even really thought a lot about until you mentioned that just now. But this is, I guess, more of like a human question, but you're a physician, and I'm not a physician of any sort. So I'm just curious what you think about, do you have any opinions about a vaccine? Do you think that that's reasonable for the public to be hoping for a vaccine to exist, or I'm kind of looking for your opinion as a medical doctor about this idea of a second wave coming through, and those of us who get the opportunity to go back to work. I'm a hairdresser, and I've been told, hey, you can go back to work, but I also have asthma, and I'm terrified of going back to work. So I'm just curious, as a physician, what are your opinions about this next wave, and then the possibility of a mutation interacting or causing us to have trouble creating a vaccine?
I think that the chances of mutation are a lot smaller in this virus than in something like influenza. The flu, we know, has many mutations and strains. That being said, I don't know that for a fact. We just don't know a lot about this. It really came out of nowhere, and I'm concerned that we are seeing changes in the way it behaves, for example, in Korea versus what we're seeing here in the United States. I think that a vaccine is going to be huge, and we are waiting for a vaccine to be produced. I'm trying to follow all of the latest information, and I know that there's a number of vaccines that already have begun clinical trials. So we likely will be looking at 12 months before a vaccine will be available, but I know that studies have begun on some vaccines. As far as will there be mutations that make the vaccines not effective, I don't know the answer, and I think we're all kind of holding our breath to wait to see what we find out every day about this virus.
Thank you.
Well, the whole idea is not really to wait for the vaccine per se, is to just limit the cases so that the people that do get infected in the future can receive treatment without overcrowding the hospitals.
Is that right?
So the way that I understand it, at least, is just being able to treat those that get infected, and that's why this whole
Yes, so we're trying to flatten the curve. We want to make sure that we don't outpace the capacity of our hospitals, particularly when we know that a certain percentage of people will require ventilators. And that is something that the United States or any country, no country has enough ventilators for 3% of its entire population to need to be in the hospital at once. So the goals of social distancing and closing things down is to try to control the wave so that there will still be infections, but we want to try to keep up with the capacity of the hospitals. And that's where I'm thankful to be in Arkansas, where I think that the way disease spread, we're a much smaller city. We're not as populated. When you look at cities like New York, where there's shared transit and everyone's very close together, it's really hard to have measures to disinfect and protect populations when they're so close together. So I'm thankful to be in Arkansas, where we've got a more rural setting, not mass transit, where diseases are going to spread as quickly.
Agreed. All right. Does anybody else have any questions?
Thank you.
I have a question.
you
What
for
about
that.
those tigers that got
Yeah.
into the zoo? What, I mean, you know, you hear about a pug getting it. I heard about a Pomeranian getting it, which I have 2 Pomeranians, so that made me nervous. And then the tigers, it seems like seemingly like random with pets.
Yes.
I guess it's not really a question, it's more a statement, but what are your thoughts?
Well, I think that it's a interesting thing because I think the answers we have next week are going to be different answers we have this week. I know that as people are spreading corona without even knowing that they're sick, we are finding that corona can cause problems in more and more different animals. So I know that I was watching the Little Rock Zoo recently, and they were talking about the things they're trying to do to reduce the risk for the population. So now all of the people that work at the zoo, they're in contact with an animal. They have to wear a mask. They have to wear gloves. I think we all need to try to step up our protocols to try to reduce the risk of it spreading to any animal.
Tigers really can't catch a break, huh?
Oh, yes.
That was such a cute little puppy bomb, by the way.
That's adorable. Adorable. Okay. Anybody else? Chance?
I think I'm gonna go to the gym on Monday when it opens. Pretty nervous.
Good luck with that.
I don't know. They want 12 feet physical distance.
My yoga mat's gonna have to do for right now. I don't think I'm gonna be going to the gym anytime soon. I don't know. The last time I went to the gym, there were handprints. Somebody had put their hand in some chalk and had, you know, and so you could just see like everywhere their hand had been, and no one had cleaned it up. And I was like, okay, gross. I'm not. No. Like literally leaving marks everywhere.
No, we're doing it way too fast. Arkansas is way too fast. I'm sorry.
That sounds really
Throw it
quick.
out there.
The
It's too
gym
fast.
opens?
Everybody stay at home. Chill out.
Yeah.
Well,
All right.
so, Dr. Ball, let me ask, what is your practice? What is your reopening plan?
We have been curbside, so we followed the AVMA's recommendation to postpone elective surgeries. So we want to try to reduce the use of gloves, surgical masks. So we postponed elective surgeries like spays and neuters, something that could wait. We are slowly getting back to getting some surgeries on the schedule. Honestly, a big challenge I think for a lot of small businesses is that it's hard to get people to come into work right now when unemployment is such a tempting option. It's hard to keep staff where it needs to be when every day that you go into work is a day that you're in some ways putting yourself at risk. I mean, you're going out and interacting with the public, and I don't know the answers to that, but I know that a lot of other small businesses are also having that reality that we're trying to navigate.
Gotcha.
So we've been curbside, and we will continue to be curbside, but we are working with less staff than we normally would. So I'm just trying to give longer times between appointments. I will continue to do curbside probably until I'm not going to feel comfortable until the numbers are starting to go downhill. Right now, we're still seeing red COVID numbers going up.
Right.
And I know that small businesses and people get back to work, but I'm just not sure I understand why we're reopening when the numbers are not done. So I also would recommend, if you're going to go to a gym, Google about the way that disease and germs can spread when you're running or jogging. I'm worried that 12 feet is not enough. When I look at the some of the things that I've seen across the internet, that's talking about how as we're breathing out, there's clouds of vapors that can spread germs, and how far they can travel when you're running.
Right. And while you maybe just sorry, I gotta pipe in and be a mama bear here for a minute. And while you may be running and cleaning off your treadmill, you know, you're spewing and you're not cleaning off the treadmill next door to you, and neither is the person that was there before. So I'm just saying, if you have to go and do this, even though it's gorgeous for you to run outside,
I run
go
outside.
and make sure that you clean off the equipment before and after.
I'm probably
Just want to keep you around.
Chance, do you want us to put some big old tires in the Bark Bar yard? You can go flip them and stuff like that.
Just gonna feel it out.
Bark Bar CrossFit for like a week or two.
Yeah.
Like 3 people in at a time.
Forget about yoga. We should do dog CrossFit.
Yeah.
Yeah.
Kara's been disinfecting the yard pretty regularly, so
We're gonna be set. Yeah. Oh, goodness.
I'll just say that we cannot wait for Bark Bar to be open again. Honestly, of like the 4 things that I actually miss about normal life, Bark Bar is in my like top 2, I think. Church, I kind of miss church. It's fun, you know, it's cool, but I miss money. I miss money for sure. But I definitely miss Bark Bar.
Yeah. Thanks. We miss you. I can't wait to meet this new one. I am very excited.
oh, it's so
I feel
cute.
like we've actually had 2 or 3 folks that I can think of. We're gonna have quite a cute little puppy group when we get back open. It's gonna be awesome.
Yeah. I'm so excited. Like, real. I heard the mall's open.
Well, that is terrible.
I
That is
know.
just terrible. And I love the mall. I'm one of those people that actually likes the mall still, but I think that's insane. Like,
I feel like around town,
never to go during a pandemic.
I feel like around town, everybody's on board with we'll only open up the Bark Bar. Everything else is off limits, but we're down to risk it for the Bark Bar.
Okay, Dr. Ball, can I ask a question about the weather? Which you're like, I'm not a weather person. But you keep hearing people talking about like it's gonna warm up, and when it warms up, the virus is gonna go away.
Well, I was listening on NPR where they were talking about this because the flu is a really great example of how it's something that typically is seen during the colder years of colder parts of the year. And we just don't know enough about the coronavirus to know whether there's any truth to that. So we don't know, but I have heard a lot about the virus being denatured in high degrees of heat. So it will be less stable. It'll make fomites less likely to spread it.
Okay. Bring on these 80-degree days.
Yeah.
Dude, it was 80 today.
Are you catching fish or what?
Yeah. I've even heard of people leaving things in their car to let the heat have contact with the back, whatever.
Like their own incubator.
So that they
I'm fishing right now.
Who's fishing? You, Liz?
Yeah, I'm fishing.
No
I'm not
way.
doing it well. I'm not doing it well.
I caught a fish this week. First one in years.
Nice.
I'm actually taking the pole out of the water right now.
DBR, sponsor me, please.
Chance, it's your go-to.
No.
Oh man. All right. Well, let's see. Do we have?
Does anyone have any other? Sorry, go ahead, Kira.
No, yeah, that's what I was about to say. Does anybody have any other questions for Dr. Ball?
Like maybe non-COVID questions?
Well, I have one last one. How would I sanitize my dog? Like if I'm needing a medical procedure at the end of this month and he's going with me as a service dog, he's trained. As soon as I stop, he goes down. Like there's absolutely no breaking it. How would I sanitize my dog? I have gotten alcohol, kind of diluted it and got it on a rag and just rubbed it on him. I don't know what else to do.
You would want to be careful about using a lot of alcohol because there can actually be toxicity from using too much alcohol. But I think that if you're using 70% alcohol or less and just
good, yeah, I dilute it in a little bottle of water, spray it.
Okay.
I get it on the towel and wipe it on him. I'm just and I wash his vest. I'm just so nervous that the Thermogens, they're gonna get all on me or get on my cats. My cats are gonna be like, hello. And then I'm gonna kiss the cat.
Doctor, is there a certain brand of disinfectant that's better for injecting our dogs, or no, not at all?
Oh my God,
no. Our dogs. Well, to quote the president, I have heard that injecting I'm just kidding. Don't do that.
Don't listen. Hey guys, work for president.
Yeah. Yeah. Don't do that.
Our dogs already have their daily 1 hour of tanning in the tanning salon to get rid of the what is that word you use?
Foaming. Y'all don't listen to him. He don't have any sense.
He's got jokes. He's got lots of jokes.
Oh, so many. I don't really. I guess I don't have a. Whoa! A squirrel just made a giant leap. Sorry.
Hold on a second. Was your thought to let them kind of sunbathe to get the heat in their fur up to kind of combat the fomites there? Was that your thought?
I don't think that's a good idea for our pets because our dogs do not have a lot of tolerance for the heat. So
yeah, he's going at all. 65, he's done.
Yeah. So I don't think that would be a smart thing to do for our pets. But if they like to sunbathe, then there are some benefits to sunbathing.
I have a question about this new tiny puppy. We have no idea what his breeds are. We know a little bit about his mom. We think we know who it is. Didn't know who it is. Of a real dog that I'm like, but he's 6 or when he gets only what I can imagine, like very breath is like.
So you're saying that he will pant sometimes?
Yeah.
Okay.
I mean, like when he goes into like a REM cycle, you can tell because he'll dream a little bit, but then other times he just.
I see that happen a lot as part of their dream cycle. A dog that's truly having trouble breathing will very often not be able to sleep. So that doesn't sound like anything to be concerned about. That sounds like an interesting dream, and I wish we could know what they were dreaming about.
Right. Well, he lived in the country, like in the woods, with his mama for the first several weeks of his life. So I think that he's probably just been traumatized by predators and, who knows what. He just lived outside all his life. And So I know he's probably dreaming about mom and, you know, who knows what else. But I just want to make sure, like, I think part of it is his coat is a lot, like, fuzzier than our other dog was when he was little. And so I'm thinking he might look like a cold nature dog to be in.
Mm-hmm. Yeah, that sounds normal, like dream behavior to me.
That's great. Thank you so much.
Sure.
All right. What else we got? Liz, do you have any questions? Lisa, do you guys have any questions?
Do you know anything about
I don't.
in your dogs as they get older?
I didn't quite hear that.
Do you know much, is there much research on how to recognize dementia in dogs?
That's a really good question. We definitely see some behavior changes as our pets age, and dementia is a degree of confusion, behavior changes that we see as they age. So yes, that's something that we are starting to recognize more and look for more now as our pets age. I actually have a questionnaire that I really like that asks a number of questions so that we can get a better understanding of is there dementia in our pets, because that's not something that the veterinarian can see during an exam, because we don't know what's normal for them. So dogs that get lost in a room that they know how to get out of the room. So sometimes they'll kind of get stuck in a room and be able to navigate the room. They may not know when dinner time is coming, when usually they're very routine and food motivated. Now they may be very confused about where to eat or when to eat. They may not know where the water bowl is. They may not recognize people. Those are some behavior changes that we look for to suggest that there may be some dementia. And there's actually some nutritional and supplements that I've seen make a big difference for dogs with dementia. And there is a prescription medication for dogs with dementia as well called Anadrol.
Did not know that. Very interesting. Right now with all of the dogs, you know, being at home with the owners, and you know, I feel like everybody's finally hit that adjustment period, and they've gotten used to each other, whether they're happy to have you home or not, you know. And now I'm starting to look at going back. So now it's going to be this trauma all over again for both humans and dogs.
And cats and ferret.
That is correct.
Oh.
Lest we forget.
I done told them I can't work past 6, guys, because I got to get out. Now, if somebody's like, but I'll get off work at 5, I could be here at 6. Okay, well, you're going to have to come and explain to my cat why I can't give him his strolly ride on time. Because I have gone
I love it.
7 p.m. every night. I have an alarm that goes off, and he's usually off leash. And then I take my cat up and down the street with the stroller. Then the stray cat that moved in, he walks with us. So it looks like I got a whole menagerie.
I love it.
Oh my goodness. All right.
So yeah, what are some tips or tricks or thoughts about how to help them readjust when we have to all leave them again?
Well, I think separation anxiety is common, and it is hard for dogs when they're adjusting to you being. So before you go back to work 10, 12 hours, it might be a good idea to leave for 2 hours and then come back. So rather than going from being home 24/7 to on for 12 hours, try to begin to help extend the time between visits. So 12 hours, be gone for 2 hours and come back. So we're trying to slow up the time they're having to spend alone. And also if there's treats, I love the Kong toy that you can stuff with the cheese. It's Kong spray. Any kind of favorite treat that they love, give that to them when you're gone so that eventually they're like, woohoo, you're gone, I get my see you later.
Those are all good.
Those Kong ideas. The Kongs for Turk, I have him about 13 different like toy stuffer toys type things, and I have a big old can of really healthy dog food. I put supplements in there, and I put a little bit of the calming aid in there, which is passion flower and like valerian root. And I mix it all in there with some dry food, and I kind of let the dry food absorb just a little bit of the wetness. And then I stuff all the Kongs, and then I freeze them. Whenever I freeze them, they last hours longer.
That's a really great idea. Yes, freeze make it last so much longer.
And it makes them eat slower.
Yes. And it's great for teething puppies too. Because if they're teething, then there's probably some pain there. So frozen treat is very enjoyable for a puppy as well.
Awesome.
There's a cute little hide and go seek game that you can get, like these awesome Bark Bar cups, or some other cups that you might have that are less awesome than these Bark Bar cups. But the little hide and go seek game, you can even use all those toilet paper rolls that you've been hoarding, and you can take the toilet paper roll and fold in one side, put some treats in there, fold in the other side, or even just that could be their lunch, separated out into 10 different little party poppers, yeah, little party poppers, but party poppers, and then just hide those around designated areas in your house. And you know, as soon as you leave, that can be like, okay, go. And then the hide and go seek game is pretty fun. It keeps them kind of busy for a while, but that's only after you supervise them with how they eat. That Turk is very nice and neat. I don't know where he got so OCD from, but he gets his little piles and he keeps it all nice and neat. And he's 11, so we've been together for a long time, so I know exactly how he destroys things. So I would feel safe, you know, so definitely monitor, try this out while you're at home a couple times before you try it out, just to make sure that they don't eat the cardboard, just the treats.
Fun. Awesome. I need to do that with Milo. I keep meaning to, and then I keep forgetting to freeze it, so all I've got is just regular dried food.
Yeah, you can even use that outside and do like keep them inside and you go outside for a second. And then while they're outside finding the outside ones, you could go do the inside ones and then leave whenever you let them back in.
That's smart. All right. Okay. So, Dr. Ball, is there anything else that we have not covered that we should, that we're not thinking of, that may come up in the next few weeks? I'm trying to think.
I can't think of anything else.
Okay. Well, we're kind of just to give folks on, you know, an update. We're kind of in the same boat as you. We're just kind of watching and waiting and trying to make responsible and safe choices for our customers and the dogs alike. We're fortunate, you know, kind of same as you again. Our business model meant that we had a whole lot of disinfectant and a lot of practices that are going to serve us well in the future. And we're most definitely going to step those up, as well as add some to that. And, you know, we just ask for everybody to continue to be patient, and that we will make announcements as we can.
So next Tuesday, you're going to let people in 3 at a time, right?
Yeah. we're probably going to go back to utilizing our appointment base which I think served us really well the first go around.
Yeah.
And we're just very fortunate with our setup that we have such an open air atmosphere, and basically, you know, you come in and it's really conducive to what needs to be done right now for the health and safety of everyone. So just keep an eye out on our Facebook, and we will update as we can. I imagine that's what you guys are doing too.
Yes. Yeah, we're doing curbside, and we will continue to do curbside probably until the numbers have continued to stay down.
Gotcha. All right. Liz, do you have anything?
No, just thank y'all so much for coming. And, you know, it's so good to keep the community alive through these little Zooms and see y'all's faces and meet your new furry family members and just kind of connect with you this way until we can go back to the old way we were connecting. I love Milo in the background. He looks like a deer kind of.
He just roams around.
He's huge. But I just really appreciate y'all. Thank you so much.
Yes, most definitely. And check back in because we'll be doing another one of these next Saturday.
Woo!
Thanks for having us. Kara, if you guys decide to extend the opening to later on for whatever reason, just know that that's okay by anybody.
Yeah.
Everybody.
Yeah, everybody.
And we'll have our Jack and Clorox when we get back.
Thank you. Thank you.
We'll support you. I'll toast to that.
Awesome. Well, you guys, everybody stay safe. And I hope to see you soon.
Definitely. And thank you, Dr. Ball. This was really great.
Thank you so much.
Much.
Bye.
Bye, everybody. Nice to see y'all.